studying speech therapy with an intern.
Beautiful. Good, good.
Isis Vargas.
How are you?
That's my daughter Camila.
Okay, the same. The one in the same, right?
Yeah.
All right.
And Barbie's sister.
Exactly.
And Bobby's sister.
Exactly.
All right. See, it's all in the family then?
I'm Marissa. I'm
Hello,
Catalina's
Marissa.
mom, and Catalina's 3.5, and she's in the Little Steps program for like 3 months now. And
Yeah.
she's doing awesome.
She's actually in the program that Justin
I was just
in.
going to say, I forgot to mention
he
that
was.
he graduated, I guess, from there.
Yeah.
And
Yeah.
it was great. He was thriving there. And now he's, I don't know, social butterfly. He goes to the parks and he's like, hello, Dustin, you want to play? What's your name? Now he's too much.
Yeah, that's right. That's where we're
It's great,
aiming, right?
It's great, yeah.
Girl,
We're
you too.
really happy.
Good,
really,
good.
Really happy.
So glad. And your name?
I'm Jan, and I have a baby. She's 25 months.
Babies are good. Yeah.
Hi, I'm Lolly, and my grandson is Trenton Mangione. That he goes to Rosemont, and
Oh,
I'm
good.
moving to Miami to help with him because my daughter went back to school.
Okay.
Not back to school, back to work,
Uh-huh.
and I'm just coming to see if I can learn a little more about trying to handle him a little bit.
Beautiful. Good place
He's
to start.
11, by the way, so he's a little older than everybody's
3
else's
months,
children.
11, you
He-
know,
and he's
kids are
doing-
kids.
He's doing wonderfully at Rosemont. If anyone, I don't
I'm gonna
know.
go check out the school today, actually.
Yeah. Oh,
what-
good.
Yeah, autism. Well, yeah, they take others
Special,
too.
they take other
They're
kinds,
doing wonderfully. Actually, he's like the oldest one there, so they're kind of experimenting with him because now he's becoming a young man, you know, and he was having some outbursts, and the doctor says, what's because he's getting his to test
Testosterone. Ah, well, you know, so keep getting it.
normal
That's our husbands. right?
now they're learning, so he's kind of
Sorry,
like
Ewan.
everybody, kind of, you know, they work it out with him, and then it helps with the other kids too.
Absolutely. Absolutely.
So, and it's a wonderful
Well, welcome.
school. Wonderful school. You'll love it if you go there.
Go check it
Yeah.
out today.
And introduce yourself because everybody else is too.
My name is Maria Molina, and my son is Dylan Zediger. He gets speech and behavioral ABA therapy here twice a week. He's 5, and he's doing wonderfully here. So I'm very happy and just continue.
And
to listen.
Maria comes to our meetings too a lot.
Yeah, I try to. Yeah,
Good.
when I can.
Good, good. Well, I think we're expecting a couple of other people, but in the meantime, I'll introduce what we're doing and things like that. I usually, as Linda knows, do a behavior series because I really feel that one of our important things. How are you? Good to see you. This is Lorenzo's mom. You want to introduce yourself?
Sure, I'm Kelly Ovino, Lorenzo's mom.
Thanks for coming. That's
Thank
great.
you for having me.
And I feel that it's really important to educate you, and as Linda said, because she's one of our big supporters here, she comes to everything, whether a child needs it or not, it doesn't matter. It's like you always learn something. You always go away with something. I try to personalize things as much as possible, and stay on the topic, but then if we need to address something, remember this is your meeting. So in setting up the series, I pick topics that I think are morning.
Good morning.
How are you?
Good.
Good.
Building.
What?
I was in the wrong building.
In the wrong building. Well, that's all right. We'll take you anyway. So what we're trying to do is to I picked 4 topics for this series, and then we do it again. We charge a nominal amount just because we help support either. We support different groups. This time we're doing Fragile X because we have some of our kids on staff that have Fragile X, and so whenever we can support the families of Fragile X, we do, or the families of autism. So we go back and forth and give back to the community and give back to you. And you guys, whether you're with me as with Kendall Speech and Language Center as a patient or not, the idea is to be fortified. And the more you know about anything, the more power you're going to have in working with, dealing with your children, professionals, other family members. Okay? So, where sometimes things seem like, really, what are we talking about that for? Like prompts and fading, okay? It's because it's something that I have found to be really, really important that really makes a difference, and it's something we don't think about until it's too late, until we have developed prompts that haven't been faded, and we think we're doing everything possible for our kids, and then in reality we're supporting them in a way that isn't going to let them be independent. And isn't our goal, I know, when you have a 3-month-old.
24 months.
Oh, 24 months. Well, that's kind of 3 months compared to everybody else. But this is a good age to start. At 24 months, even, you know, when they're young, the last thing we have in mind is that our kids are going to be independent someday. Like, really? We don't want to let them go. We want to be there for them. We want to make sure that we're helping them along with everything. But our ultimate goal is they need to be independent. Now, number one for you and your family. Your family needs to have your kids going to the bathroom by themselves, putting on their shoes by themselves, setting the table by themselves, feeding themselves. Not just for you, but because it makes them feel like $1,000,000. When they do something like put their own shoe on, it's like, really? They've just discovered a whole new power, and as we're trying to do everything for them, they become very prompt dependent, and when they become prompt dependent, wherever you take them, they can't do it on their own. We don't want that, because by the time they get to be 11 years old, we want them doing all those things by themselves. You don't want your child having to be showered by somebody at 12 and 13 years old. Really? You don't want that. You don't want your child to have somebody else disciplining them in any way. You're their parent. You're the one that does it the way you want to do it. So now you have to think in terms of independence. So today I wanted to talk to you about, and as I said, we keep this kind of informal, kind of formal, and I'm going to pass you out a couple of things that we're going to be talking about today. If you can pass one and pass it on, if you don't mind. Then you can just write on that and follow some of what we say. And I'll tell you a little bit about what we're going to talk about. Prompting and fading is some of the most important things that I teach my staff on a regular basis, because we're getting, hi, how are you? Come on in. We're cozy, but that's good. Cozy if you want. Up close and personal. And there is tea or coffee. There might be. I don't know. I make tea.
By the way, I got a Keurig for Christmas, and all I could think about was you. You know that, and your mom.
My mom with her third Keurig. Oh, did I already buy one of these?
You know who's getting like that is my husband. He's like, I think I'm gonna get one for the office.
Did we already have it, right? We were talking about my mother, God bless her, she loves to do, you know, as mothers do, they start to watch Home Shopping Network, and so while she's staying around, so she orders one, and then she forgets she orders it, and then she's got a second Keurig, and then she forgets she orders it, and she orders a third, so all of a sudden, you know, when we get there, we're all getting Keurigs for some reason. That's my mother's Keurig. So, alright, yes?
I know you'll probably explain this, but just off the bat, I don't know what you mean by prompting and fading at all.
I'm going to tell you.
Awesome.
Yes.
Because I know everyone else
I'm going to start at the, you see, here's a lady that came
clue.
to a presentation with no idea what we were going to talk about, but we're going to learn something. Okay. So when we're talking about prompting, plain and simple, you're talking about giving your kid a cue to do something. A cue, a clue, okay? And prompting, when we do a prompt, prompting is very important. When you're learning something new, you just don't. I mean, think for a minute when you were riding a bicycle, okay? Did you all just jump on does everybody ride a bicycle? Did you all just jump on the two-wheel bike and take off? No.
Pretty much.
Yeah, some people do.
No, that's how they teach it down there. Go, go, you figure it out.
Okay, so no, you didn't. You didn't. You got on the bike first of all, and you had training wheel. You did?
I did that way.
Yeah, because
I
you
fell.
know, you're a man. Okay, I got other things to talk to you about. All right. You get on the bike, you got training wheels on it, you got your dad or your mom, usually your dad behind you holding the bike going, go, 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 don't worry, I won't let go, I won't let go, I won't let go, right? And of course you let go and you know, you were off on your own before you knew it, all right? But we didn't do it without some kind of support. We didn't do it. We don't usually just hop on things and do it. Prompting is what happened. Our dad helped us by putting the training wheels on. He started with very obvious prompts so we didn't fall down, they're a little wiggly. And then he started holding us and helping us that way. And then he ran by us and just grabbed us every once in a while. And then, that was it. Then we were on our own. Okay? So, prompting is going to be a very important key to what we do. It is going to increase the likelihood that your child will do something that we want him to do, or that he has to learn. Hi, how are you? Welcome back. Just got back in from Egypt, so here she is. Good to see you, Sarah.
Hi, how are you?
So prompting is something that is going to increase the likelihood that your child will do what it is you're teaching him to do. Whether it's to go to the bathroom, whether it's to put on the shoe, whether it's to say ball, whether it's to pick up the toothbrush and use it, whether it's to start a conversation, whether it's to continue a conversation, on any level. Of course, the cues are going to be different, all right? And it's important that we, in the terms of speech people, we call it scaffolding. Scaffolding what they're learning, helping them get to the point, but we don't keep the scaffold up forever. Like in a scaffold of a building, when we're trying to repair something, it doesn't stay up. The idea is to fix it, pull it away, building looks good again. Okay? With our kids, our job is to scaffold them, prompt them through, help them. But the problem is, as well-meaning parents and adults, we forget to fade the prompts. So now, it's not that your child can't do something, but they wait for you to say hi. How many times I watch you come into the waiting room with your kids? And everybody says, sorry, you're all busted, pretty much. And you all say, he says hi. He uses greetings all the time. Really? Watch this. Child walks in to the waiting room with the mom, and the mom says, say hi to Miss Wendy. Prompt! Okay? Go give Miss Wendy a kiss. Prompt! Okay? Those are prompts. So, we inadvertently are prompting our children all the time. Can your child brush his teeth? Can your child get dressed? Oh, sure. Yeah. Socks. Pull them up. Hands up. Yeah, sure. Can they do the actual physical manipulation of it? Absolutely. They can do it. But not unless you say something. Do you know how many children I've had come in for evaluations? Because we have people that come from all over the world, and the parent says, oh no, I'm telling you, he can do all that stuff. Really? So I sit back. And the child sits back too. And she says, well, you got to tell him. I said, really? Then I guess he doesn't do it by himself. It's a whole behavioral thing we've got to pull off, ladies and gentlemen, okay? So that's what prompting is. Prompting is giving our kids and scaffolding them to the desired level, and then we gotta fade it. And fading is when we gradually reduce the prompts so that the child can do this now without assistance. And I say gradually, we decrease that level of assistance a little bit at a time, not too fast, but not too slow where they get dependent on it. We decrease it until they're able to complete that task, complete that activity, say that word without your assistance. Okay, that's our goal. And that's what we're talking about with prompting and fading. And it's not as easy as it seems. Because it's a lot easier to do it for them. It's a lot easier to help them through it. It's a lot easier not to see them struggle. And it's a lot easier because if you do it and you say something, then they won't break down into a major behavior tantrum.
Excuse me, is
Yes.
it also considered prompting to, like, when they're doing something they're not supposed to do and you're like Dustin lately, I don't know if it's because now he's not saying Korean, he's doing something to irk me. He goes like this, like he licks his fingers, and I said, don't do it. So he'll look at me and he'll go,
Okay.
And I keep on telling him no, and then I'm like, I'm becoming a nag, and he probably doesn't hear me anymore because I keep on saying, don't do it, don't do it, don't do it. And
That's
I know
a good
he shouldn't.
question, and I don't think it's prompting. I think, and I'm just going to touch on this basically, just so you get the idea. There's 3 reasons behaviors happen. You either want attention, you want to get out of doing something, or it's called, actually 4 reasons, and take it back. You want to get out of doing something, you want attention for something, it's because you don't have the skill to do something. Okay, if I don't have the fine motor ability, I don't care what you promise me, I cannot tie my shoes. Okay? Got to have the ability first. And number 4 is called junk behavior. Junk behavior is done to irritate you.
That's the one.
That's it. Okay.
I can see it in his
It's not the
face.
same as attention because
No, sometimes it can be attention, but what you do with junk behavior.
You can tell because if you're looking at them.
Formal things, we totally get off topic, okay? Just so you, those of you who haven't been with us before, and we'll be back on.
Sorry.
Junk behavior, we do it, yes, it might be for attention. And what you do when it's a junk behavior, whining, those kind of things.
But I can tell it's junk because if I'm talking to you and you do that thing, then obviously I'm paying attention to you. So
Exactly.
yeah.
So what you do is total, unequivocal, 100% in body, word, and posture. Ignore. Pretend it's not happening. Just say to yourself, and if you need to, you can say to him, because sometimes as adults we think it's rude if we do something and we don't. I'm not going to talk to you as long as you're doing that. So go ahead and say it. Makes you feel better. You 100%, totally, unequivocally, don't move your body. Don't look at him. Pretend he's not doing it. You want a behavior to stop real quick? Planned ignoring, if that's the cause of it.
Well, and I
Okay?
don't have a poker face, so I know that even my eyes will
Turn
go like,
around.
yeah, and I know that he doesn't do it at school because I asked Liz, and she has no idea what I'm talking about.
Turn around.
Yeah.
Walk out.
Okay, thank you.
Move away.
But that's
Walk
not
away.
prompting.
That's not
fading.
prompting.
Okay.
No. Planned ignoring, and we can talk about that another time. All right. So when we're teaching a new skill, and the overall goal for us in any skill, you can put a skill in your mind that you're trying to teach your son, grandson, child, cousin, whatever. The whole idea is to teach that child to eventually engage in that skill independently. This goes for speech too, when we're working on speech, not just on other things, okay? For example, when a skill is taught, we initially start something when they don't know how to do it. You've heard the term hand over hand prompt, where we take that child and we hand over hand show them what we want you to do. Pick up your toys. Pick up your toys. And we help them do it. That's called a hand-over-hand prompt, okay? And the idea is that he is successful at what you've asked him to do, that he sees you demonstrate what is it you're supposed to do. He's supposed to be doing what you're asking for him, and then once he's gained mastery of that skill at a particular prompt level, we need to fade it. We need to take it away. We need to use a less intrusive prompt. That whole hand over hand is a full, what we call a full prompt, where you're using everything you have to do it, okay? And we want to ensure that your child doesn't become dependent. Yes, he can pick up his toys. You know he has the motor ability to close his hand around the toy and put it in the box, correct? Okay, if you can do that, then now that hand over hand, you've just shown him, and then you have to back off. All right? So, we all use cues. We all use hands. We all use hand over hand. We have a whole list of things. Those of you who uses schedules at home for their kids? Anybody use schedules?
Picture ones.
Yes?
Picture.
Good. I should probably, in this room, I should see all of you raising your hand, and if you don't, you're busted. If you're on my territory. You prepare checklists for kids. Some of your older kids, who has teenagers or older kids, you have checklists for them where they mark things off. You probably
I
would do it with
my
Dustin.
end,
Yeah. Do with older kids, you start marking things off, modeling something you want them to do. Those are all called prompts and cues and hints. So we're going to go through a couple of different levels real quick. This is our buddy Julian. Mom gave me permission to use Julian, and I'm just going to show you some of the different prompt levels that we use. And these are, the way that I've set it up is just a combination, and then we'll talk about the order that they go in, okay? So if I can figure out how to use a machine, then I'm gonna be good, because you know, mental challenge is my name here. This is Julian. The first prompt that he's gonna do is what we refer to as a gestural prompt. And a gestural prompt can include pointing, it can include nodding, okay, that you're nodding to something, any other type of action that the learner watches you, the adult or the teacher, okay? For example, if a mom says, "What can you drink from?" and she points to the cup, that's called a gestural prompt, okay? It's a prompt that tells them what to do, right? We don't want that to continue, and we're going to want to pull that off, but the tendency is when they don't respond, what do? Point or nod or look at the object, okay? So this is Julian, and watch, saying and doing a gestural
What's
prompt.
he drink from? A cup. Yeah, cup.
Okay. Then he knows the answer, right? Okay, that's what we refer to as a gestural prompt. And we do that quite often because our hands just kind of fly. If our hands aren't flying, even, I'll watch in therapy when I'm watching therapists sometime, and they'll go, kids pick up on subtle cues. So all you have to do is go, and the kid knows that's the one, and I pick it up. That's called a prompt. Poker face, we've got to work on you on that. All right. The next thing we're going to talk is full physical prompt. This is that hand over hand, where your physical contact is going to be made to guide the learner through the entire thing that you've requested, the activity that you've requested. You're going to do a full physical prompt. For instance, if I say to you, clap your hands, okay, we're going to see a mom do it, a real mom, not saying it, but if you say clap your hands, then I would take both of your hands and clap your hands, all right? Always being very careful, everybody, to make sure that you say what you're asking them to do while you're doing the action, because our goal here too is to teach your kids language. Your goal is to get them to learn words. You can't say clap your hands and then go over to your child, take his hands and go like this, because the connection isn't made. So you have to do clap your hands. Match your words to what you say at the time that you say it, all right? So. Well, it's not going to work, huh? See? Ah! Well, come on. Yeah, we don't want ocean. Sorry, everybody. It worked on my computer, and I asked for a big one so that we could see better.
Clap hands.
Oh, there you go.
Clap hands.
Now, obviously, Julian doesn't need that, but that's what. Hi. So that. How are you?
Good, how are you?
Good. Good to see you. So that's called a full physical prompt, and we do that a lot with our kids, especially if your children. I don't know which children here have motor planning issues, but motor planning issues being that they can't initiate the motor movement, and they need, Lorenzo's like that, they need the assistance of you doing it to help them get started. Once you get started, they can do it, but they need that assistance initially, okay? All right, now, and I'll talk about that in a minute because we do a lot of prompting, physical prompting in the mouth, so I'll tell you. Next one is called partial physical prompt, and this is where you, the mom or the dad, are going to provide some assistance to guide your child through part of the requested activity. Not as much as that hand over hand. So if you say, pick up your toys, you might prompt him by gently touching his hand to get him in that direction, okay? So that he will, you might just nudge him. So you're only doing a partial. And that's part of pulling off what we want to do.
Pick up your toys.
Okay, that's what we refer to. It's just a gentle nudge as opposed to the hand over hand. Okay? Now, another one is what we refer to as a partial verbal. This is with you guys that have verbal kids, or you guys that, even when we're not, we just start to make the sound or the letter on our lips. It is enough to get the child moving. So if we use a full verbal prompt, okay? The full verbal prompt would be something where we provide the child with a spoken, complete response of what we just asked the child or what we want him to say, all right? And so you might say, what did you eat for lunch? And then the mom says sandwich and waits for the child. Now normally what I like to do is say, sandwich, what did you eat for lunch? And the child says, sandwich, okay? That's called a full verbal prompt.
Sandwich. What did you eat for lunch today?
Sandwich.
Yeah.
Hopefully they say it with some zealous. All right. And then when yes.
You give her the vocabulary word basically.
Mhm.
And then,
If we're just at the
you
very
do that
beginning.
all the time.
Yeah, no, because that's the
Well, at
prompt.
the beginning, when
In the beginning, you may have to do that. If you have a child, you know, one of the things that we learn in some of our for some of you who have taken our hand-in courses or individual hand-in, some of you are currently involved in, one of the things that we do is that we would give them initially what to say and pull it off, okay? Children have different personalities, just like you have different personalities. And when we build everything, then meld everything together, we've got different ways that we have to react. I don't know your child, so I don't know the personality, but if we have a child that's more reluctant, and many of our kids, when they have challenges in communication, they have a more reluctant style of talking. Why would you want to talk if nobody's listening to you? Why would you want to talk if people aren't understanding you? You know, so sometimes we have a very reluctant style, and those kids respond very well to a full verbal prompt like that initially, and then we want to pull that off. Okay, that's what we're talking about today, is fading it. So the full would be, oh, like for example, if you have another case would be children with that are echolalic. Okay, children that are echolalic, if I say how are you, what do they say? How are you? How are you? So what I have to say is, I'm fine, how are you? And they'll say, I'm fine. And they usually don't remember the last piece, that's what happens. Okay, so we give them the answer that we want, followed by the question real quickly, so that then they tune into the answer that we gave. All right? So that's what you're talking about initially. Now, with a partial verbal prompt, or what we refer to as a phonemic prompt, the mom, are going to provide for your child a part of the response so that maybe just the first sound of it, okay? Or you're just going to move your mouth in a certain direction. So for example, if you say, what day is it? What comes after Thursday? Initially the kids don't know that. So what you might do is go, or a phonemic prompt would